Hey team, I just wanted to do a video because it's a nice way to sort of communicate with you all, and it's a nice quick way to communicate with you all. We would normally be taking advice from Peninsula before we make decisions and before we implement things. But as you know, I was explaining the other night, by the way, I've washed my hands, so if I'm touching my face, just in case anyone was worrying. I was on hold for an incredibly long period of time to get through to Peninsula. I got some very basic advice at that time, and then Kasia was struggling the next day to get through. She has since gone through to Peninsula and gone through the idea which we are implementing of people moving into Liam House and staying and working at Liam House. They have advised us that as an employer, I can't ask you guys to work for more than 48 hours. So I wanted to be incredibly transparent and incredibly honest. I'm happy for myself to be here 24/7. That does not bother me and it doesn't concern me, but that's my decision to make. In regards to you guys, I am responsible to you as your employer. So I just really wanted to be incredibly clear. I'm not asking you to do this in an enforced manner. I believe what we're doing is a sensible thing to do. I have faith that this decision does statistically limit our risk of exposure. And I feel at the moment that's pretty much the only thing we can do. Today I got up so early, I didn't even have time to think about what I look like. I don't really care what I look like at this point. I think I might have some of yesterday's mascara on. It's been hectic. But it's just a strange thing. Like for the care industry, we're being advised that should we have a suspected or a confirmed case of corona, that we should be wearing these. This is a fluid repellent surgical mask, and we should be wearing an apron and some gloves. I've got the gloves over there. But that doesn't protect you from coronavirus. So I don't know why we're being told to wear it. My team have been absolutely amazing. I'm so grateful to them. We took the decision to divide the team in two. And my team A moved in, I think it was Thursday. I don't know, every day's the same. I think it was Thursday. And so they've moved into the building. We're wearing this because what this does do is potentially protect our clients should any of us have been exposed and not have symptoms, which I believe can happen with coronavirus. So I have a team that are working tirelessly to get things done in the house. Our clients are learning disabilities, and for them this is quite hard to understand. I mean, it's hard for anyone to understand a pandemic and the consequences of it, but for them it's difficult. We started social distancing on the 15th, when the day I moved in. So they hadn't been out in the community at all. We closed to visitors as a precaution, and as I say, on Thursday, I think it was Thursday, yeah, my team A moved in. So we're all in the building doing everything we can, trying to keep COVID-19 out of this house, because some of our clients fall into a high-risk category. And I'm just really disappointed that, you know, Public Health England, is it Public Health England? I'm so tired, I don't even know what I'm talking about. But yeah, the advice we get is that if nobody is symptomatic, we don't need to wear anything. But that doesn't cater to the risk of people who potentially have been exposed but don't have symptoms. So as I say, our team A, we're working in these. We got 300 of these given to us from the government. They come from the influenza stockpile. When we called the national line to see if we could get any more PPE, which is protective personal equipment, such as these, this is what this is called. And they advised us they'd already sent masks and aprons. They haven't sent us aprons. I've bought aprons. I've spent an absolute fortune on PPE. I'm so keen to keep my staff safe and myself. I have an autoimmune disease, I have asthma. The best thing I could be doing right now is self-isolating at home and not being around anyone, but there is no way I'm going to leave my team to deal with this on their own. Of course, I'm going to be present and I'm going to work with them and be by their side. But yeah, I just find it sad that we're not really being given effective advice, that, The reality is if we had a suspected or a confirmed case of coronavirus in this house, we would probably need either N95s or FFP3 masks, which are sealed. And they're reliant on fitting correctly as well. So it's not just about having the mask, it's having the right mask. So for example, if you're a man and you have a beard, it's probably better to shave your beard so it fits to the face. Oh yeah, my nails are gone. Look. Life is tough. I don't even have nails anymore. But yeah, that's not the advice we're being given. Nobody's mentioning the FFP3s or the N9. In fact, no one's been talking about N95s for a while. It's weird. I ordered on the 14th of February 14 N95s. They have yet to come. It says that they should arrive by Monday at latest, so we're praying that they do. We currently don't have any suspected cases within the house. We're really hoping our precautions have paid off. But yeah, I'm just, it's a mad time to have a care home and to work in care. And it's mad to me, the advice we're being given, because it just doesn't correlate with science or with people that are telling us, what we need and what we don't need. At this point, I have faith in the NHS. I have faith in doctors telling me things. I have faith in mask specialists telling me things. I have faith in scientific papers that, distinguish between what is a safe mask and what isn't. But as it stands, the advice just doesn't seem to be right. And that concerns me. It concerns me a lot. So, people are thinking if they wear gloves and aprons and these fluid repellent masks, that you're protected from coronavirus. I don't think you are. Like, I am not an expert, but I have read so many papers and I've looked into this to such a great degree, and I just find it super disappointing that the information that seems a lot more factual doesn't seem to be shared that much. And then what advice we are given, like from Public Health England, about when to wear a surgical mask and when to wear an FFP3, it doesn't correlate with other information out there or what the World Health Organization says. So we're just doing our best, but what we're doing, I think, is a bit different. Like, as I say, we've got our team A in. We're hoping testing becomes available, but then depending on what the testing is and how it works, until I know more about that, I can't really quantify if I can safely bring a team B in. And I'm really looking at, the way we worked before and our rotas and the staff patterns is going to be different now. While this is still a risk, while we haven't flattened the curve and it's increasing and cases are increasing and deaths are increasing, I really want to keep my clients safe. I mean, I want to keep my clients safe, full stop. They're amazing. My dad bought this business in 2002. I lived in for the first 2 years of business. My clients are everything. They were my flatmates for 2 years. I've learnt more from them than anybody else in life. But it's just constantly assessing and keeping up to date and people sending you information and you're reading things and, you read a 46-page document and then they send you another one and maybe like one paragraph is different but nothing else is. It's just a crazy time to be in care. But I just wish there was more honest support, and I'm more interested in what doctors are telling us. I'm more interested in what the Italian doctors on the front line or Spanish doctors, I'm interested in what they have to say. I believe what they have to say. And when you are thinking about PPE, I know some people have been a bit like poor Boris Johnson, he's got a mild case of corona. I don't really feel sorry for him at this point. We've known about this since December. I think it was December 17th, it was officially known that China was experiencing this. That's a long time to get PPE. And the people who are on the front line, I don't know if they have the correct PPE. That's devastating. I spent 8 weeks with my mum on an acute respiratory ward. I've seen how these people work. They're absolutely amazing. They work tirelessly. They are brilliant. My mum was an incredibly complex case. Her physical health was quite complex, but her mental health was also quite complex. How they dealt with it, amazing. I can't stop thinking about them, and I could cry to think, what if they're working without the right stuff? What does that mean? What risk is there? So for me, as a registered proprietor of a care home, the only thing I've been able to do is to statistically reduce risk of exposure. That's all I can do. But our government really needs to provide everybody working in hospitals with what they need. It should be in stock already. It blows my mind that it isn't, and not only just about protective clothing, what about equipment like ventilators and ICU beds? And we've neglected our NHS for so long. I love our NHS. It needs our love. It doesn't need to be privatised and sold off. It needs all of our support. It needs more funding. We need to support everybody that works in the NHS, because the reality is, if you get this, and you might get this, and you're struggling to breathe, you need the NHS. And you need an ICU bed if it gets seriously bad. And if you can hear snoring, that's Brew Brew. Thank God I can bring Brew Brew to work with me. So he's keeping me sane. But yeah, I'm blown away by this experience. I'm so shattered. I don't have the energy to be angry. I am barely speaking to any of my friends because I just don't have time. I'm writing policy and procedure, and then I'm rewriting it because new information comes in, and then I'm rewriting it again because something else happens. I'm trying to do everything I can to keep my clients and my team safe, but I'm so grateful to my team, because I've joined quite a few Facebook groups for the care industry, and just hearing some stories and how people are reacting to this, I'm really blessed with my team. They're amazing. So I just want to send lots of love to everyone. Please stay in. Please don't take any risks. If you get this and it's bad, it's not good. We all need to do our part to flatten the curve and to not put too much pressure on our healthcare system. So stay in. Please don't moan about getting bored, because some of us don't have that luxury. I'd love to be bored. Love to be at home right now. I have no idea when I'm going to be home again. Brighton seems like a distant memory at this point. So sending you all big love. Be careful. Wash your hands. Sing happy birthday while you're washing your hands. Don't touch your face. Although I have done through this, but I've sanitized my hands and washed them. And I've been in gloves all day. And I'm now in my room, and it's only me in here and Brew Brew. So big love. Think about the NHS. And please, when you're voting, when the time comes, think about the NHS and remember this situation. And remember that we have doctors telling you that there isn't enough PPE. Big love. Right, guys, another little video. So I just wanted to do a video to just make it incredibly clear. Everybody needs to be working in a mask, gloves and an apron at all times. I also want to introduce, as of now, if somebody is eating and has their mask off and they're eating in the kitchen, please only one member of staff eat at a time. So if two of you want to eat, you'll have to take it in turn. I was just reading the words of our Prime Minister in regards to care homeowners. I'm enraged. I'm so enraged, I'm calm. The reality is, the guidance at the beginning was not okay. It really wasn't. Sending people into the community without testing and into care homes. Also, when we talk about care homes, we're not just talking about nursing homes, we're also talking about LD homes, learning difficulties. I'm an owner of a learning difficulty care home. From the 15th of March, I don't think that week after that, I got more than 5 hours sleep a night. I worked tirelessly. I moved into my business. I lived at my care home for 15 weeks. I pretty much worked 80 plus hours a week. The reason I didn't get much sleep at the beginning of this is I felt that the things I was reading in the guidance didn't really ring true to me. We were told in one of the first statements, which our Prime Minister can't even admit was written, it was something along the lines of, it's unlikely that care homes will be affected by this. This is when we were seeing Spain and Italy savaged their care sector, absolutely savaged. We were seeing doctors on the front line in Italy pleading and saying how serious it was, how you have to make decisions. So much was coming out, and I couldn't believe I was reading official guidance that suggested it wasn't going to be an issue for the care sector. It was very clearly going to be an issue for the care sector. I just, to suggest that owners didn't perhaps follow things clearly or as you would have liked, I don't believe that to be the case for 1 second. I chose to go above guidelines from very early on. My team were in fluid repellent surgical masks from the 15th of March. That was above guidelines. At that point, guidelines were stating that we needed those masks solely if we were doing personal care, basically with a client that was either confirmed or suspected of having COVID-19. I also chose to get some FFP2s and FFP3s, and I also ordered full face respirators. I ordered protective gowns. It took a long time to get hold of all of this. At the beginning of this, it was also hard to get food. We normally rely on the supermarkets delivering, and we weren't able to do that anymore. We had to find new suppliers. We had to utilise delivery services. Part of my contingency plan was for me not to be going out into the community and to be self-isolating with my clients for two reasons. I think it was an important thing to do. I think it was needed, but also I wanted to be supportive to my clients. We tried initially to move staff in, then realised it's quite a strain, so we reverted to having people come in daily but limiting the foot traffic. We closed to visitors from the 15th of March unless it was a doctor or something urgent, that's something where our clients it would be detrimental for our clients not to see, whether it be a nurse or doctor or LD team. We provided PPE if they didn't have it, but of course most medical people do have it. I've worked 80 plus hours a week for 15 weeks. I've only just come home. I've taken, in that time, I think I had 2 or 3 days off, but in at my business. I didn't leave the business. I had 2 or 3 sick days in those 15 weeks. And I have come home for the first time in 15 weeks, and I'm exhausted. I'm drained. I'm so grateful to be home and to appreciate all the things about being at home. But, I've just lost my faith and the guidelines and... I haven't lost my faith in people. I've lost my faith in this government. I don't think this government has handled the situation well. I think it has been incredibly detrimental to the care sector. And I thought I was over the upset of that because, time goes on and you get used to being in a pandemic. You get used to living in an incredibly loose lockdown that keeps getting loosened. And I hope that we're not following the path of other countries that are having more and more small area lockdowns. We already have that in Leicester. I just know, as someone that works in care, my life will not be normal for a very long time. Until we're clear of this virus, I want to limit my travel. I'm changing my work patterns. I will try and take a little bit more time off because I think that's good for my well-being. But to hear our Prime Minister blame owners in an incredibly inflammatory statement, I have no respect left for this man. I just don't know how anyone can respect him at this point. So I always think when I see other people documenting things like, I wish I'd done that about this period of my life, or I wish I had more of a record of this time. And today is a first day for me, so I want to start documenting from my first day, so I can look back at this and see where the journey takes me. I think, like a lot of us, this year is, like for a lot of us, this year has been a really tough year. And the pandemic, has affected the world. I think there is obviously a huge decline in people's mental well-being and people's mental health. This is something that we didn't really talk about enough before. Now, I think it's even more vital we talk about it. But I don't, in different countries, there's different levels of support. I know in the UK, I sort of had the feeling that, there was a decline in funding pre-coronavirus. And then we have coronavirus, and it's incredibly difficult for a lot of people. And I think it's so important to reach out and ask for help. And that is probably one of the hardest things to do when you're struggling. So for me, today is the first day I took my new antidepressant. And I called my GP on Friday. I think it had been brewing for a while, but I just felt like I was scaring myself a little bit, and I realised that I was really struggling with coping with everything that's happening. For me personally, I think I lost my mum in December last year. It was an incredibly complex relationship. I love my mother dearly, but she had been abusive for many, many years of my life. I was very blessed that I got to spend her last 10 weeks with her. I was blessed that I got some beautiful moments, like all the things I thought I needed to cope with that situation, I got. The mental health team sort of gave what I would call like a pencil diagnosis, because she wasn't that involved with it, so it was more from feedback from everyone. And looking at her records and taking feedback from the ward and from family members. And that in itself really helped me to understand why she had been the way she was, the areas she struggled. During those 10 weeks, it was very apparent, her mental health at times, well, most of the time. And it was helpful for me sort of to understand it better. So I think, at the time, my priority was spending time with her, being there for her, making the decisions that needed to be made, trying to protect her at times because she needed that. Sadly, there are some people in the world that beeline the vulnerable, and my mum was definitely vulnerable. And I got through that period, but after she passed away, I really, really struggled. Like, I think the struggle for me is those 10 weeks. Everything I saw, I think it's really difficult. It's definitely difficult to process all the things that happened during that period. So, in the one sense, I'm blessed because I did have some moments that were really beautiful. So I can mourn my mother and think of those wonderful moments, and that really was like what I believe was my mum underneath all of her unwellness. But also I sort of have to come to terms with the journey itself, and I think, I was spending hours and hours a day there, and at times either living at the hospital or at the nursing home. So, I have no regrets in that sense at all. I don't really have any regrets. I regret the fact that she had such difficult mental health and she was unable to get help. But as in, I wish it was different, but that's the way it was. And I think when you see someone struggle so much, I'm aware what I need to do to look after myself, I suppose. But, so was struggling at the beginning of the year with that. I find it really difficult dealing with my mum's estate because everything to do with her really is a reflection of her mental health, so it's a real trigger. So just going into a house, I find quite difficult although I like it at the same time. But there's things that I've needed to do that I didn't earlier on in the beginning of the year before Corona, because I was just sort of on the floor grieving and just trying to get through the days, really. And I sought help then and got diagnosed with PTSD. And that was humbling because I'd sort of never really experienced anything like that. And it's incredibly overwhelming and difficult. It's a terrible thing. Like, I wouldn't wish it on anyone. But yeah, so it was sort of trying to pick myself off the floor from that. And then I inherited my dad's care home 4 years ago. 4.5 years ago. Well, I've been in place for 5 years because my dad got sick at the Christmas, so I stepped into his position then, and then he passed away 6 months later. So having a care home during a pandemic is something quite different. It's unseen amount of pressure, and I'm quite morally motivated. So, you know, I'm never going to just do the bare minimum. I always want to go above and beyond. So from day one, I was very much looking into how we can stay safe, how I can keep my team safe, how I can keep my clients safe, how can I get hold of these things that I desperately need but nobody can get hold of, what do I have to do? So I sort of went from being in a position of really struggling to having to snap out of it. And I think, to be honest with you, that's one of the reasons that I'm incredibly frustrated and feel incredibly let down by the government. You know, if I'm pretty much having a nervous breakdown and I could pull my shit together to handle a situation, I don't see why a whole body of people that weren't having a nervous breakdown couldn't do better than they did. But yeah, so then sort of was in pandemic mode. That was wearing and exhausting in itself. I moved into my business for 15 weeks. Didn't come home. Didn't really have any time off. Would work long hours, and then in the evening I'd be desperately trying to find, I don't know, suppliers that had stock, or beg people to sell me some type of PPE, or, you know, it was just endless. Or even we were struggling to get food delivered because the supermarkets completely forgot about the care sector. So where we normally get Asda to deliver, we couldn't even do that. So thankfully we hooked up with some suppliers that are amazing. But pre-pandemic, I pretty much did one supplier order and one supermarket order a week. Now we have several suppliers and, you know, utilising lots of different things. So it's a lot more time consuming. But yeah, so you go through that. And I've also had 2 or 3 other deaths since, this year. So that was difficult and takes you back to the sense of loss. And then my health has been... thank God, you know, when I was at the business for those 15 weeks, I definitely struggled with my health at times. And I ate an obscene amount of gelato just to sort of keep my calories up because I wasn't really holding the weight very well. But it was all manageable. Like, I could get through the day. My GPs were amazing. The company that delivers medication for my clients kindly also did mine. So I had great phone support from my GP, and then my medication would just arrive at the house. It was amazing. So there was lots of things that, you know, were very helpful during those difficult times. But I think, I don't know how many weeks ago it was. I don't know, 10 weeks. I don't know. I don't even know. But a good few weeks ago, I started to really decline. Started to get very weak physically. Started to feel a bit similar to how I did when I had a perforation in my bowel. And that's something that sort of needs urgent care. So went into A&E, and thankfully I didn't have a perforation. So I got to go home that night, because I think for anyone with long-term illness, it's horrible. Like, you're living your life and then you go to the hospital and you get kept there and you can't come home. So it's always a bit of a fear. Like, I always make sure I've got a bag packed when I go, or have it ready so someone can bring it to me, so that I'm not tempting fate to be kept in. Cause I strangely feel if I have a bag ready, they won't keep me. And if I don't, then they will, because it'll be unexpected. But yeah, it's my little superstitions on hospitals. And so I knew before that my B12 and my folate were really, really, really low. And I was waiting for a blood test, but there was delays with that because of the flu clinics. So I literally couldn't get my blood test for a while or start B12 shots because there was just no slots. So eventually did that, and I've had this before. So the last time it happened, you know, I had my shots, had the tablets, the folate afterwards, and yeah, you know, I was all right. But I just, you know, I'd come home for treatment, still wasn't feeling good, was getting worse, finished my B12, still didn't feel good, was on the folate, didn't feel good, felt very weak. You know, I wasn't able to do the things I was doing before, and considering I was bashing an 84-hour week out with no problem, to suddenly sort of having to have a few naps a day or at least lie downs, it's quite humbling. And when it happens so quickly, I feel like with Crohn's, and probably for other people with other illnesses, like you have your life and you have your fitness, and then something happens and you lose it all almost overnight. So that I think was really extra challenging and humbling, because I have a lot to do at work, and I own a business and I'm responsible for it, whether I'm sick or not. I'm responsible for my team, I'm responsible for my clients, and you know, that's a big responsibility at the best of times, but during a pandemic it really does feel like an extra weight. And I think, you know, we are very much inundated with updates. They're relentless, and at this point it's my personal feeling that they are counterproductive, because I think if you overwhelm people, then they just don't take it in. So I think clear, simple, not overloaded messaging is vital, and it's something the care sector I don't think has. We're just inundated to the point, you know, you're reading these things and then there's another one from another body or somebody else, and then you're like, I don't even know who these people are. Like, we've not heard of these people before. Who are they? And then you're reading it, and you have to check, is it relevant to us? Because we're an LD home, learning disability, so a lot of things are for elderly. And so I just, it was like when I was starting to feel unwell, I also was really starting to feel very overwhelmed with these updates. And then it's just gone on, but I'm still having to go back to work, and then I'm coming home when I can, and I'm tired. The last stint I was at work, I'm very grateful that I have a really cool team. They're amazing. And so I was able to sort of go downstairs and then go upstairs for a bit and rest. And I just can't push myself. So combining all those things together and continuing to feel unwell. And then, like, during this as well, during, I think it was lockdown, I started to have, like, drooping eyes. So one of my eyes will, like, droop down, and I can't open it really properly for love nor money. And it was happening when I was quite tired, but I was quite tired a lot because so much to do all the time. So I mentioned it to my doctors a while ago, and they were like, you need to come home, you need to take this seriously. We want to refer you to a neurologist in case I think it's called myasthenia gravis. So that was also going on. And finally, I've seen the neurologist. I have the test on Friday, so it'll be good to know either way, because I'm definitely getting my droopy eye every now and again. I feel really self-conscious about it as well, because it's like, do I look drunk or something? Because you just can't keep one of your eyes open. It's really present. But my team were pointing out to me, so again, amazing team, thank you. And so it's just this whole decline in my physical health. This is, something I've been through before, but it's been harder this year. And as well, because it wasn't something that needed like an emergency admission, those kind of things almost get you going quicker, because, like if you have a perforation, you might get sepsis, so they have to take you in, you have to have antibiotics, maybe they have to do a surgery, maybe they don't. Thankfully for me, luckily, I managed without a surgery, which was amazing. So those kind of situations get the ball rolling, whereas I'm in a situation now where I sort of reached a point with the GP. They're like, you need to see your IBD team. Reached out to them. They're like, we want to bring the appointment forward. Amazing. And then ages later, they call me saying, oh, we're going to give you an appointment. Amazing. And then they write to me to say they're going to give me an appointment and that I should call them. I call them and they're like, well, there's a huge waiting list, so it won't be till, I don't think, next year. Well, I'd got an appointment anyway, which was the one they were trying to bring forward. So at least I've got that one. But I think if I didn't have that, I probably wouldn't be seeing anyone till next year, unless I see my private doctor. So, yeah, I think the combining all these things together, it just felt too much. And I think I'm a strong person. I've had a fair few crises in my life and some incredibly challenging situations. And of course, I've got through it all because I'm still here. And it's really been the first time that over a long period of time, I got to a point where I just felt like I couldn't cope anymore, like it's too much. You know, I can't get on a plane and go to Mallorca, which is something I like to do. Helps me feel a bit better. So yeah, like I was diagnosed with cyclothymia, which is it's sometimes referred to, I think in America they call it like bipolar's little brother. Some people call it a mild version of bipolar. It's like a more rapid cycle. So to be fair, growing up in the environment I did with my mum, like I think I'm quite blessed that was the diagnosis I got when I was 26. So I've never really, I think I had medication one period for that. Wasn't the best, didn't really help, made things worse. It's also actually a drug they don't use anymore for cyclothymia. So, you know, I've managed all these years with doing therapy. I'm such a fan of CBT. And I've really found it useful to negotiate, like, you know, there's lots of things we can't change the way we think, where we can't change, but we can change the way we think about it. So that had always been such a coping mechanism, and having a years long toolkit of what I do to get through a crisis, how I cope with life, how I manage, you know, how I'm feeling, and all those things had worked for so long. And partly because of the pandemic, I don't have access to all of those coping skills. Also because of my health, like energy wise, I don't have the ability to do as much as I would if I was in good health. It got to a point where I was just on the floor, you know, that sense of it's all too much, it's all too overwhelming. It's too much to do and I don't know how to do it. I don't have the energy to do it. So today was my first day of taking my antidepressants. I was going to start on Saturday, but I had a 48-hour migraine over the weekend and I'd taken so much other medication. I just didn't think those were a good day to try any other medication, so I started today. So this is the first day and I have rambled on for nearly 20 minutes. It's quite spectacular. I didn't know I had so much to say about it. But yeah, so I'm going to start doing a video diary. And I want to note my progression and to talk about it, because I don't think I should feel ashamed that I'm struggling, and it's okay to not be okay. So yeah, this is day 1. Just wanted to do a black and white video because I like a black and white video, and if you'd been working as many as I had, you would probably want to do a black and white video because it's a little bit more flattering for a woman of my age. But just wanted to say happy holidays to everyone. Life is just super hectic and I am at work and I'm working 7 days a week, all hours really. It's just pretty intense. And I'm still cross with central government, who lovingly sent us a massive 65-page update yesterday. So instead of enjoying time with my clients, I've just been creating paperwork and making files. And this is on top of all the other updates we get. It's just ridiculous. I just think that, you know, information overload is a thing. So if you want people to successfully implement things, you need to be mindful of the fact that we're all human, and I don't know how other people do it. Like, I'm working 84 hours a week and I'm struggling to keep on top. So if you're working a 37-hour week, I just don't know how you can keep on top of it. It's just mind-blowing to me. But yeah, so I wanted to wish everyone happy holidays and apologise. Just feel like having a little moan fest. This week my plans have been a bit hard to maintain. My Crohn's has been popping up in really weird time frames, and it's annoying because you schedule something, you have a plan, and then you know,
You have to jump off the phone or something. But last night I didn't really sleep much. I've had a very crampy stomach pain period. It just blows my mind the amount of waste product the human body produces. I just don't, I don't understand. I don't know how it's possible. Like, you reach a point where you just think, I'm empty. You're not empty. And then you get really thirsty, so then you're drinking a lot more. And I am, so I'm not where I'm supposed to be today. I'm working in bed at home. I think I'm going to be a bit good to myself and try and take some time off, because I'm looking at my computer screen and I don't even know what I want to do or what I'm trying to do. I can't make decisions. I'm really tired. I've messed up my time frames with my vaccine. I thought it was in 2 weeks. It isn't. I had some steroid and local anaesthetic injections. So you're supposed to wait 2 weeks. I don't even know what kind of a decision I need to make about that. I'm just so tired. So maybe it's not a today decision. I can't even speak. The only person that is happy about me feeling unwell is my dog, because he's in bed with me and he's living his best life. My dog lives for bed. He loves naps. He loves bed. I just wanted to do this video because I'm so tired of people saying that Boris, could anyone else have done a better job? Yes, they could have done. And sticking up for this man that doesn't deserve this. Look how New Zealand has handled things. They've done amazingly well. Our government has continually asked us to do things and absolutely made a mockery of it. There are people taking cocaine in Parliament. Cocaine. And then you've got Boris, who has got absolutely no concept of why people take drugs in the first place, and is trying to penalise them by taking away driving licences and passports as a concept. Why don't we invest in mental health? Why don't we look why people are taking drugs in the first place? What has happened in this country that has caused such a breakdown that for some people the only answer is to be numb because they can't cope with things? If we look at sort of homelessness, if we look at addiction, if we look what's actually going on, we need more support, we need investment in these areas. I'm so angry at Boris. I'm so tired. I'm a care home owner. I've done the best I can. I've had no deaths. I had one client case that didn't leave the room. I acted quickly. I'm hearing Sage now talking about, HEPA filtration and CO2 monitors. That's something I looked into in March 2020. And it's something I implemented then. And I can't even utilise the infection control grants for that because I did it way before the grant was even a concept. And I'm unallowed to backdate. So essentially I'm penalised for being responsive. But as someone that is registered under CQC, it is part of my role to be responsive. So I shouldn't be waiting for our incompetent government to pick up the pieces. And I didn't. And I'm just... Why is Boris our Prime Minister? Why is he still there? Why are we allowing this? Why is it okay that so many people sacrificed so much last year and they were getting drunk and having tea parties and doing quizzes with a plastic bag over a camera? And Matt having his little affair in the office? They're all an absolute disgrace. I'm disgusted to be British, and I'm sat here now in my care home taking a well-earned break. I've done 44 hours in 3 days. I'm shattered. This is because our government has let this happen. We've had Brexit that saw a mass exodus from the care sector. We've had enforcement, another mass exodus. The pandemic itself, mass exodus. So what's left is people like me working all the hours that God send. I mean, annual leave isn't something I've had since February 2020. It's an absolute luxury. I have people telling me, take some time off, look after yourself. I'd love to. But who's going to cover me? There's 100,000 vacancies in care. 100,000. I'm so angry. I'm so upset. And I'm sick of hearing people stick up for that incompetent wanker. Morning. So, I'm at work. I came down on the 13th. I've had people on sick leave. I mean, it's a nightmare getting staff anyway, so we're having to use agency, which is incredibly non-productive in a lot of ways and costly. Now, thanks to our lovely government not listening to Sage's suggestion of a circuit breaker, I have one of my really strong team members isolating for 5 days because he's been in contact with a positive. So I was supposed to work New Year's Eve night, which would have been a bit of a blessing because it would have meant I'd have get paperwork done. Because at some point, one of our clients that's one-to-one 24/7 would have been asleep and I'd have been able to sit in there on my laptop and work. But because of having an AWOL and a self-isolation, I worked all day yesterday instead. It's absolutely exhausting, and I do struggle a little bit as well with other people telling me they're tired because I've worked every day since the 13th. I'm scheduled to go home on the 9th. I'm desperate to stick to that because I have the hospital on the 10th. But the reality is I'll have worked constantly from the 13th of December till the 9th of January. And that's not just doing my job, that's doing my job and covering other people's jobs. I got a decent night's sleep for the first time last night. And that's only because I managed to jiggle the rotor a little bit so I could, I'm not on the floor now till 2:00. So in principle, I should be utilising this morning to catch up on paperwork. And instead, I'm lying in bed. I've got inflammation in all my joints. Everything hurts. My back hurts. I've had a cough and cold for weeks and weeks and weeks. It's definitely not COVID because I'm testing all the time and I wear a FFP2 mask all the time when I'm around people, even outside of work, because I just really don't want to get sick any more than I am. I have existing health complaints, so it would be mad for me to risk anything else. But yeah, I'm just lying here. I just don't have any motivation. I'm just so sore and tired. I'm in a process of staggering my medication so I don't bring it back up. I've been, where I'm struggling with my Crohn's, I've had to sacrifice food quite a lot just because I can't handle the pain of the digestion. I know I put on quite a bit of weight when I was on steroids. I've pretty much lost all that since the 13th. And the reason I do this, I know these videos aren't that popular. I know everyone likes to see the glitzy ones where I'm I'm just trying to remind myself that I have glitter in my veins. But I think these videos are important because the reality is it's a really, really difficult time, and there is going to be a lot of people working in the NHS and the care sector that are absolutely exhausted, and we're keeping going. But I know that there's been some predictions of burnout and a percentage increase. I think it was something and don't quote me on the figures, I think it's something like 15% to 30%, which is quite a high figure. I know everyone's sick of hearing about COVID, and I know everyone's sick of, restrictions or whatever it needs to be done sometimes, or wearing masks. And particularly since our government can't lead by example, it makes it harder. But really, the people that are going to be suffering the consequences of poor government and fuck you government attitude, which I have, but at least I'm wearing masks and being sensible, and I definitely haven't spread any COVID. It's just, your loved ones, you yourself, might need to go to hospital at some point. You might have a family member that is reliant on a care home to look after them. You might know someone in that situation. And I think seeing this government's neglect of these sectors, it's mind-blowing to me. So I'm thinking of, good well-being practices of looking after myself and stuff. I'm lucky if I'm getting a shower. I've had a few baby white washes just because I've been cooled down to the floor with no time. last night, although I did get a good night's sleep, I stayed up a little bit later so I could dye my eyebrows and my eyelashes as a little treat to myself. And I had a shower and washed my hair, which was absolutely luxurious. But, you know, I'm recruiting and I'm getting quite a good response, but I don't even have the time or the energy to reach out to the people that have applied. I'm shattered. So I think I'll have to send them emails and maybe speak to them tomorrow. So yeah, that's care in the UK in what was 2021 and is now 2022. So yeah, I just wanted to sort of do a video to sort of remind people to sort of see it from a little bit of a different perspective, you know. But anyway, Happy New Year, you all. Have a morning, Gillian. Please excuse my appearance. I'm working on very little sleep. I see Sky News is reporting that troops are being deployed to London and that to help out with the NHS, and that Boris Johnson can no longer ignore the crisis with the NHS. But are you going to ignore the crisis in the care sector also? Like, I very much hope you guys are up and doing something this morning. Would love to be brave enough to do this in colour, but quite frankly, I haven't washed for a long time. I certainly haven't brushed my hair. I'm working triple-hour figure weeks. Care sector under this government. I'm tired. We're all tired. All I'm reading is warning after warning after warning about people being off either because of Omicron or general illness. We're raising concerns about burnout. And what's our government doing? Nothing. And I'd just like to highlight for anyone that thinks that, you know, you're hearing on the news about all this funding that's coming through to us. Well, let's talk about the Recruitment and Retention Workforce Fund. Let's talk about that. So I'm a small independent care home. The amount is so minimal, the only thing I can see fit to do with it is to reward my team with it. It certainly is nowhere near enough of the amount needed. I am so rushed off my feet. I literally don't even have time to be recruiting. I'm emailing people in the middle of the night. It's not ideal for me to obviously call people in the middle of the night. So I was hoping that I could utilise that fund to employ someone for 4 weeks. Well, that was a hope that's just been dashed because I now understand the figures. It's disappointing. So then let's talk about the infection control grant. Wasn't really able to utilise that because most of my expenditure was prior to the grant. So I'm being penalised for being responsive. But under CQC, this is one of our inspected areas. I'm required to be responsive. I was responsive. I'm so sick of this government, and I just, you know, what do we have to do? Nobody listens. I keep writing letters. I've written to politicians. I've written to everyone. Nobody listens. The only thing I get back is standard responses. There is no point sending me something I already know. I'd like to feel heard, and I'm sure I'm not speaking just for myself. It's just shocking. I'm so tired. I started work on the 13th of December. I haven't left the building. As I say, first week was 101 hours. I don't know what I've worked the following weeks because I've stopped counting because I find it depressing. This is what care sector is like under this government, and it's disgusting. It is nearly 5 to 10. It's still the 31st. It's still Monday. I'm at work. I'm staying in my care home. I'm exhausted. This is like the precious time I have to sleep, and I can't sleep. I can't sleep because I listened to Parliament Live today. When enforcement came about, I wrote to whoever I could. I was really concerned. There was no impact assessment before the vote in the House of Lords. It was very apparent the negative impact it would have on care. As a small independent care home, I'm registered for 10 clients. I currently have 8. I work so many hours. Last time I did one of these videos, I was trying to reach out to Gillian Keegan. I
I felt desperate. I felt angry. I felt a lot of things. I'm numb. I'm angry. I'm awake. I don't want to be awake. I'm working really long hours. I want to go to sleep. Care is not an experiment. We were the people that really went through it. We have been let down time and time and time again. And to suggest that it was important because of Delta, can we talk about that? Can we talk about how 2 vaccinations, after 30 days, your immunity to Delta drops? Can we talk about the transmission? Can we talk about how, yes, statistically, if you reduce the amount of people that are unvaccinated in a care home, it might help. But also, you're going to have other people coming in. Visitors didn't have to be vaccinated. So it only takes one person. Statistically, it's less likely, but it doesn't remove the risk. So I don't understand anymore. I don't understand the guidelines. I don't respect the guidelines. I respect independent SAGE. I like their Friday briefings. I respect science papers. I respect the fact that testing papers for masks were very much available pre-pandemic. I don't respect downgrading masks. Surgical masks, what? We know about masks. We know about HEPA filtration. NASA uses HEPA. We know about CO2 monitors. We should have had an influenza stockpile. You can't count 2 gloves as 2 items. I don't know that many people that work with one hand. I'm so angry. I just don't know what to do with it anymore. I'm an ant in the run of things. Nobody's going to watch this. Nobody cares. But my God, I feel better for saying it. It's black and white because I haven't had anywhere near enough rest. I haven't been to the hairdresser since March 2020. I haven't had annual leave since March 2020. I'm exhausted. I'm tired and I'm angry. I have a 0 death rate at my care home. My clients are safe. My clients are my priority. But this government is disgusting. And to turn around now you've done all your damage. Do you know what the damage was done when you started talking about enforcement? Never mind actually making it happen. What are you guys thinking? And why is it we see it, news articles with someone wearing an FFP mask? But can I get one on the PP portal? No, I have to pay for that. And I've been paying it for a long time. At the beginning of this, when I couldn't get other masks, I've got full face respirators. I've got half face respirators. Do you even know what they are? I wrote begging letters to mask suppliers because they were only supplying the NHS. I begged. I worked 84 hours a week and every night I read science papers. I read about historic pandemics. I learnt. I made decisions. I utilised air filtration, all of which I can't claim for from the Infection Control Fund because I did it before the fund and you can't backdate it. God, I am so angry. This girl is angry. So I hope you guys are sleeping. I'm not.